Hello, everybody. This is Joe Tippens here, and I'm here with Adam Payne and Josh Ballou of Ultra Botanica. And Adam, you got somebody else you want to introduce as well.
Yeah, well, we're grateful to have joining us today a functional doctor that's been a friend of Ultra Botanica, Dr. Deanna Wyndham. Hi, Deanna.
Hello.
Hey. So we got a lot of questions to go through today.
Yeah, and let me start by saying I'm not. Ivermectin is completely out of my wheelhouse, and I'm just not qualified to answer anything about it. I will tell you, I'm skeptical, but all of the questions that are related to ivermectin, we're just not going to cover because it's not part of my protocol.
Okay.
Yeah, and I'd like to let people know that the broadcast, of course, will be posted on Facebook today, and then we're going to be doing some post-production editing of that and get that back out here. Now, Adam, are we going to be able to make that post-production edit available on the blog as
Yeah,
well?
the blog will have
Perfect.
within a week we'll have an edited version of this, and then at most 2 weeks, but the live portion of the broadcast will be available immediately on the Facebook group because it's recording there. So
Perfect.
we got a lot of questions. If anybody, you can call in with your questions as we're going. We'll try to squeeze you in. The phone number will be posted on the bottom of the screen there. It's 405-694-4729. But let's start. We had a bunch of questions that we were able to capture from yesterday.
Yeah. First one is a question about fever and digestive upsets on Finben.
And this is from Laurel Estrada.
Yeah. I have to say that with literally tens of thousands of people globally taking this, we get reported somewhere between 5 and 10% of the people have, some discomfort and diarrhea. But if it's 5 to 10%, I wonder whether it's the Finben causing it or something else. So I just
So you're
don't
talking.
know.
So the question was wondering if you had any herxing, which is from a Herxheimer reaction once you started Fenben, any fevers, digestive upsets, and how's your body feeling during this time period cancer was dying off? So so what was your answer there?
My answer is that it's less than 10% of the people out there that have that experience, and if it's less than 10%, I question whether it's the Finben causing it or something else, because these people do have cancer.
Dr. Wyndham, does cancer cell die-off create any kind of Herxheimer-like reaction?
Yeah, it can. And thank you for asking. I was going to pipe in there. Just the die off of cancer cells sometimes can do that. And it doesn't matter what you're using to treat it, whether it's Finben or other natural supplements or chemotherapies. You can get reactions from the die off. And I would guess that that's probably more related to that than it is to the medication.
So it could actually be a good sign that you're getting those kinds of symptoms and indicating something going on.
It can be seen that way.
Yeah, I know that there's a book called How to Starve Your Cancer by Jane McClellan, and she talks about pulsing the kill cycles. Is that something that you would recommend also?
Me?
Yep, you.
Sometimes it depends on everybody's so very different, but often we'll do something like that where we pulse for a few days on, few days off, or weeks on and days off. The same thing that they do again with chemotherapy. Now, I'm not an oncologist, just so that everybody knows.
Yeah. Well, could you just a couple of words to introduce yourself to the community?
Thank you. I'm an integrative medicine specialist, which means that I utilize a lot of research and science-based therapies that aren't standard of care. And in relation to that, I've treated cancer with patients for almost 20 years now. And but I'm not an oncologist. I'm an integrative medicine specialist, and I specialize in psychoneuroimmunology, which includes the immune system, cancer, and autoimmune disease.
That's great. We're grateful to have you here today. Let's go on to the next question,
So
Joe.
there's about 6 questions spread throughout here in terms of hormone-positive breast cancer and HERS-negative breast cancer, and somehow on the internet it's just it started that Finben will make it worse, and I've never heard that. I don't believe that, in fact.
Are they saying that there's an estrogenic kind of effect?
Yeah, and I'll give you an example. On our last Q&A, I made the statement that the one type of cancer that I didn't think was good for this was hormone positive and triple negative breast cancer. And then the next call-in lady that called in said, that's not true. I have that, and it's been perfectly successful for me. So I don't know, but I think some of these internet solution people out there that start making statements, I don't think they have the scientific background for their statements, and I still think the downside risk is virtually zero, and there is upside.
Yeah, there's also been comments about curcumin having an estrogenic effect, and we've never seen that in the literature actually being demonstrated. I've yet to be convinced that there's an estrogenic effect of curcumin. And we have Rick. We have a phone call. Who do we have? Oh, you're live. What's your question, sir? Hello.
Hello.
Yep. What's your question?
Yes, sir. What's my question?
Yes, sir.
Okay, it's my whole thing is that I'm getting these kind of surge of feelings or whatever, like going up from the lower part of my back and then coming up. I've had some prostate issues, and I'm going to be getting another PMS test, and one came up positive, and so now I'm getting like these feelings around my ribs or whatever, and around the front part on the right hand side, right there where it comes together in the front with my rib cage.
Okay. Do you have have you been diagnosed
it feels
with
weird sometimes, and sometimes it's painful, and then sometimes it just.
what? I'm sorry. What's your name?
Kind of weird.
What's your name, sir?
Mike Loya.
Mike, have you been diagnosed with cancer?
Yeah, I had a very minor case, and I got on a naturopathic therapy.
Okay. And are you using the Joe Tippens protocol, or did you have questions about the protocol itself?
Which one exactly is Mr. Tippens protocol?
Okay. Well, I think you need to do a little bit of homework and take a look at the mycancerstory.rocks blog and educate yourself. There's plenty of people on there that also on the Facebook group that could help you. Let's go on to the next question. Thank you.
So the question is, do you take Finben now that you're in remission? And the answer is yes. I recommend, if people are no evidence of disease and in remission, that they continue indefinitely with 3 days a week versus 7 days a week.
So just to clarify, you're saying once in remission, going to 3 days a week?
Yes.
Okay.
And the next question is,
And let me also comment here. If people are in remission, our suggestion is to work with an integrative physician or naturopath, and we've developed an alternate to pathway 1 for people that are in remission called Maintain, which is a more dilute form and a less what do you call it? It tastes better.
yeah.
So it's called, and it's less
palatable.
expensive. It's palatable. It's called Maintain. It's a dilute form of pathway 1, and I would recommend staying on pathways 2 and 3 almost indefinitely also, just because they have all sorts of other health benefits.
Next question is about skin cancers, both basal and squamous and melanoma. And we have some very fascinating success stories, inclusive of internal ingestion of Finben, but also taking the topical cream form and using it topically on skin cancers, and really amazing results with that. So yeah, there's lots of success stories out there.
So people are using it topically.
Yes. So next question is, how long before you see it working, and when do you start feeling better? Well, that's a loaded question because everybody's different. I can tell you that after 5 years on this journal of hearing everybody's story, that the earliest it's worked in my experience is 6 weeks, and the longest it's taken is 18 months. So, and everybody is somewhere in that range of 6 weeks to 18 months. There's quite a few questions later about 4-stage pancreatic, and those are probably some of my favorite stories. Well, I've 7 that I've documented and know about that had 4th stage pancreatic, told to go home and hire hospice. And in all 7 cases, the cancer, it didn't go away. It didn't kill the cancer, but it kept it at bay and allowed them to live a normal lifestyle years beyond what they were told they were going to be able to live.
So they were having evidence of disease still 18 months and more after.
Well, then in 2 of the 7 cases, after 18 months on the protocol, they went NED, which is unheard of for 4th stage pancreatic. Okay?
Interesting.
But the range is 6 weeks to, I'd say, 6 months normally. But there are people that have gone 18 months.
And Joe, I've met a number of people over the phone that are years into their pancreatic cancer experience using Fenben, and they're still working and have a great quality of life, which
Yeah.
is remarkable.
Next question, it says, has Fenben had success with lymphoma, leukemia, chronic lymphoma, leukemia? I just say broadly that we know that it does work on blood-borne cancers. We have success stories that have come in on both multiple myeloma, some leukemia cases, and so forth. So I think the downside risk is 0 for those kind of cancers, and there is some evidence of upside. So the question would be, why not? So the next one says, from Vicky, desperate for clarification on the pros. I read some patients take only Fenben, CBD, curcumin, vitamin E, and the others add additional vitamins, including C. And the reason I changed the protocol a year ago to Onco 1, 2, and 3 in addition to fenbendazole was because over 5 years of research and talking to hordes of people, I came to the conclusion that the Onco 1, 2, and 3 by Ultra Botanica, because they can get it to absorb into the bloodstream rapidly and efficiently, became game changers to go along with Fenben. People ask me all the time why I eliminated vitamin E from the protocol early on, and that was really simple. There are so many cases where you should not take vitamin E, and the rules are complex. I just had to dumb it down and say, let's get rid of the vitamin E, because people don't know all the rules and don't know when they should and shouldn't take it. So that's the only reason why I eliminated it.
And Adam, we have a call as well.
Okay, hold on. I just on the vitamin E question, Dr. Wyndham, did you want to comment about that at all?
Yeah, I often the core of the Joe Tippens protocol, I think, is an amazing protocol that I've seen patients use effectively a lot. I often have people on other supplements, nutrients, diets, IVs, other things that they're doing. But then I have seen some very notable cases, such as a man that came to me 10 years after he was given a death sentence for metastatic pancreatic cancer. And he'd been using the Joe Tippens protocol with the fenbendazole at that time, and he didn't have the benefit of all those other things that I often do for patients.
And the vitamin E question, did you have any comment on that, Deanna?
I often do. I'm sorry, the question was exactly.
Well, some people are using vitamin E and other people aren't. And Joe's comment was that the rules on when to use vitamin E seem to be pretty complicated.
True. I have. It is always a case by case basis with patients. I haven't seen vitamin E hurt anybody.
Yeah.
All right. Okay. Do we have a phone call, Rick? Okay. Let's. You're live. What's your question? Hello? I guess we lost them. All right. Well, hopefully they'll call back, or if they show up, Rick, let us know. Let's go. Let's continue. Oh, hold on. You're on the. Are you there? Hello? Nope. Okay. Never mind.
Okay, next one is I have the exact same small cell lung cancer that you had, Joe. I've been trying to figure out the differences in responses from different people. Some people seem to respond quicker, as you did, others not, blah, blah, blah. The question he has is it possible that my massive weight loss that was unintentional had an impact on the cancer, like unintentional fasting? And the answer to me is no, because my wide metastasis happened after the unintentional fasting. So it didn't, it made it, my unintentional fasting made it worse, not better. So I don't think that was why. I believe everybody's reaction to this is going to be different. Mine took 3 months from wide metastasis to all clear. Others have taken 6 months, some 6 weeks. And I'm not a scientist to know why. I do know, and I fervently believe, that the downside risk is so low, and there's so much evidence of upside, that the only question people really should be asking is why not.
Yeah, it's a great question. That's a great approach.
Next question is, where can I purchase quality, safe, large quantities of Finbin to stock up? I'm going to cover that and other questions later about alternate supply of Finbin. The people that sell this really are mad at me for saying this, but I really do not recommend using anything other than Merck's, Panacure, or Safeguard brands. These other companies are buying this stuff in China and Eastern Europe. We have no idea whether they're GMP authorized facilities and clean facilities. And there's been actual assaying testing that shows that they're not at the purity level that they claim on their labeling. So I just say, why would you buy some entrepreneurial product out there that they're sourcing from China and not from a company the size of Merck that with all of their internal controls and safeties? I just fervently disagree that people should be buying that stuff. Next question is, when the cancer is in your brain, somebody misunderstood. I never had brain cancer. And in fact, probably one of my most interesting journey stories at MD Anderson was small cell lung cancer has a 95% chance of metastasis to the brain if you take a prophylactic whole brain radiation. That drops from 96% down to 4%.
Wow.
And so I did the prophylactic whole brain radiation as a preventative measure, and it never metastasized to my brain. I get frustrated when I see some oncologists who don't understand that with people with small cell lung cancer and don't recommend the preventative whole brain radiation, and then all of a sudden they have mets to the brain, which is really, really bad. So it didn't happen to me because I did the preventative.
You know, you think about it, the lung empties almost straight from the heart into the brain, so it's a
yeah, and I
pretty
guess
quick
for some
channel.
reason, small cell doesn't want to go where there's been radiation before. That's very interesting, right? So, next question is: where prostate victims, cancer victims, have successfully used Finbin or Mebin, what extra supplements do they take? I'm trying to stick this very narrowly to the protocol, which is Finbin plus Onco 1, 2, and 3. We have a lot of prostate success stories. I mean, a lot. Next one is kind of a four-part question. Is
we're now entering into people that have emailed questions to us, and we have a big stream of people with questions on the screen there. Hopefully we'll get to them.
This is a four-part question. Can you take fenbendazole during durvalumab immunotherapy? And I say absolutely yes. We have a lot of evidence that this protocol works well in conjunction with immunotherapy. And then I don't know where some of this stuff comes from on the internet. It says once you start taking, you have to take it for life. And I've read if you stop, cancer comes back with a vengeance. That's just not true. I'm going to take it the rest of my life at 3 days a week, just as a prophylactic and a preventative. But I know lots of people that after they got into NED, they just went off of everything, and the cancer hadn't come back with a vengeance. So it says, would it be better to start after all radiation, chemo, and immunotherapy? So I say if it's radiation or immunotherapy, you should be doing it concurrently with and parallel to those. The only time you don't take Onco 2 is the day before, day of, and day after chemo, active chemo. But when you're not on active chemo, you should be doing Onco 2 as well.
Dr. Wyndham, any comments on when would you recommend people go in general on the protocol?
As soon as they feel like they want to get rid of the cancer, I would start it. Yeah, there's really no reason not
That
to
would be
take it again.
yesterday.
Yeah. Again, there's some potential interactions with very specific things, but they're very, very narrow. Fenbendazole really doesn't interact with much.
Yeah.
So it's pretty safe to take with most everything. And you can look up any interactions.
So here's a question for Adam from Rick. He says he's ordered Fenben and Pathways 1 and 2. He has been on these for 2 weeks, no side effects whatsoever. I was concerned about the curcumin's blood thinning and haven't ordered Pathway 2 yet. I think he meant 1 and 3. Don't know how important number 2 is.
So, so number 2 is super important because it addresses the wild type P53. Curcumin activates P53, which is a very important target in cancer. It also targets STAT3 and TLR4, and quercetin covers some of those targets also. If you read Jane McClellan's book, and if you follow a bunch of other people that are big thinkers in this, and read the 20,000 plus articles that are in the scientific literature, curcumin is widely discussed as being really important as an adjunctive supplement in cancer, but not to be used during chemotherapy. There are specific circumstances for specific mutations where curcumin synergizes with different chemotherapies, but those are decisions that an integrative physician or an integrative or an oncology certified naturopath can answer. So in general, that's why we don't recommend curcumin pathway 2. But on the blood thinning side, curcumin interfaces with a part of the thrombin pathway called FXA. And there are some other blood thinning drugs that will interfere with, and there are many that it won't interfere with. In general, what I've heard from physicians, and Dr. Wyndham, maybe you can chime in here in a second, is that because it's such a reversible interaction with blood thinning with curcumin, is that you scale up cautiously, and then if you get bruising, you scale it back, and to see what kind of results you get. But we would strongly recommend working with an integrative physician or naturopath if you have any blood thinning concerns, because it can interact and it can be an issue in some people. Dr. Wyndham, do you have anything to say?
Yeah, and some of the blood thinning impact of the curcumin is actually very beneficial because cancer itself is a prothrombic state, which means that it increases the risk of thrombosis or blood clots.
Oh, interesting.
So that impact is actually very beneficial. The FXA pathway is also the same pathway that Eliquis takes, or Eliquis uses. So we need to be potentially careful with those two. But again, anytime you're doing, as you said, any sort of anti-blood clotting factors, if you're already on a medication, you need to work with your doctor. But it does resolve in about 8 hours. So it's very transitory, and it's not like you're taking 2 blood thinning medications.
Right.
Okay, good.
So
thank you.
There's 3 questions on 2 pages, all surrounding the same thing, and they are about ovarian cancer. And here's a cool story. So when we started with the OMRF project to audit success cases, a ovarian cancer specialist at Stanford University proactively called OMRF and said she wanted to join the study. And when they asked why, She said she had 3 miraculous recoveries in 1 2-week period with ovarian cancer that she couldn't explain. So she brought them in and interviewed them and found out they were all 3 on the quote-unquote Joe Tippens protocol. So she became as a chief scientist at Stanford on ovarian cancer. She became a believer and joined the group with the University of Washington, and they've actually now published success cases.
Oh, wow.
So the second question here related is this guy says he's or she has lung cancer and decided not to do chemo or radiation, but just the protocol. I've been on it since September of 22. How long should I wait before I get another test? Well, the whole idea of testing is a political one, and the insurance companies don't want to pay for pets. I think anybody with cancer needs to be a squeaky wheel and demand a PET scan at least once a year. I'm on a 6-month cycle. I've been NED for 5 years, but I'm just for peace of mind. I still want a PET every 6 months just to know that it hadn't reared its ugly head again. And whether it's a CT with contrast or a PET, so I think you should have a test in 6 months if you're trying to go protocol only. And one of the other questions in this bed of questions is, is it only with traditional chemo, radiation, and immunotherapy conjunction, or does the protocol work on its own? Look, out of the hundreds of success cases, I know of 24 where they did only the protocol and eschewed all other traditional medicines and had success. So I typically advise people, hey, it's cancer and it'll kill you. Why not throw everything but the kitchen sink at it and do everything traditional medicine wants to do parallel to and concurrently with the protocol, and why not?
Dr. Wyndham, do you have do you have people that just don't want to do chemo and radiation and surgery? What's your general approach with them?
A lot of my patients, actually. I would say probably more than 50% of my patients don't pursue, out of their own personal choices, choose not to do traditional treatments. And there's a large body of research and evidence for other types of natural therapies, like IV vitamin C, which is a Trojan horse that selectively kills cancer cells while making healthy cells healthier.
Wow.
Even cruciferous vegetables and broccoli reactivates, in research, actually reactivates the P54 gene mutation, which allows cancer cells to mutate too fast. And so there's really a lot that people can do. And those two things are just kind of brushing the surface, but there's really so much that people can do. And there are cancer treatment centers that specialize in just integrative therapies, and they don't do any chemotherapy and radiation and have very good success stories.
All right. So just because you're not going to an oncologist to get poisoned, cut on, and irradiated, there are other options that you can find in the medical community. I think that's good for people to know.
Yeah.
And I would also like to say that in regards to testing, I definitely prefer PET scans over CTs with radiation. And that's because of the radiation itself, and also the chemicals that they give you in order to see it better. And then I really do believe that monitoring is super important. So whether it's tumor markers in your blood or PET scans of your body, looking to see where you are and having that peace of mind, or finding early if there's some sort of recurrence so that it can be treated, is really important.
Right. Well, again, I've had to go to war with my insurance company pre-Medicare and now post-Medicare on PET scans, because they just, generally, they like to reject them and not pay for them. So you have to be the squeaky wheel.
Yeah, which is true. And you can be the squeaky wheel. And sometimes you can find facilities that will allow people to pay cash up front for a dramatic reduction in the cost of the test too.
Next question is
Just a one comment. Some people haven't been able to call through with their questions and be getting a busy signal. I think we fixed it, so please call back with your questions if you were not able to transfer.
okay. Next question is the Joe Tippens protocol effective for swollen prostate? I guess he's talking about BPH, benign prostate hypertrophy. I'm not sure. The three pathways by which FinBin is working are clearly targeted at cancer cells. I'm not sure if it has any impact on just a swollen prostate. I'm not qualified to answer that.
Okay.
Next lady says, my husband has aggressive muscle invasive bladder cancer, stage 4. Are you accepting any success? Yes, we have lots of bladder cancer success stories. I believe Onco 1, 2, and 3 and FinBin should be taken immediately, especially for stage 4. The next question is about P53, and there's a whole discussion we could have, an hour-long discussion on just P53. But the importance of FinBin, and one of the three pathways that the scientists learned that why FinBin was working, was it was replacing mutated P53 or even for whatever reason just low levels of P53 with new healthy P53. Why it does that, I don't know, but they have absolutely determined that it does. Let's see.
And so does, while you're looking, so does curcumin and broccoli helps to restore the wild type P53, which is the type that fights cancer.
So
Okay.
that broccoli
Or
seed extract.
cruciferous vegetables, yeah.
So like broccoli seed extract, sulfofuran, or glucoraphanin.
Right. It's specifically all the cruciferous vegetables. Broccoli is the one that's most used, and there's broccoli extract that you can get in supplements. And I think you guys have one too, although it's not on the pathway.
Yeah, it's called Ultra Broc. Yeah. So that's a great discussion we should have, adding in broccoli seed extract into one of the pathway products. Interesting.
Right.
Okay.
So here's another 4-stage pancreatic story. Met's very bad. Again, I have 7 cases that are just amazing of 4-stage, and they're living long term. So I'd say get on it as quickly as possible. Adam, here's one for you. Has the dosage of Pathway 2 changed? It's still the same on the website.
Well, we did change it when we changed the formulation. So just a couple of comments on the change of Pathway 2. Pathway 2 used to use a cysteine residue as the scaffold for the curcumin quercetin LPS technology. It was we thought it was going to be the best concentrated scaffold, but it turned out to have significant manufacturing issues. We were losing more than 50% of the batches. It was also causing the capsules to crack and it was just a mess. So we decided about 6 months ago or more than that, about 9 months ago, to change to a brown rice protein scaffolding, which is organic and also very well absorbed and doesn't have whey protein in it. It necessitated having more of the material because it was the ratio of curcumin to the protein is different than the ratio of the curcumin to the cysteine. The short answer is yes. Instead of 1 capsule twice a day, it's now 3 capsules twice a day. There's some added benefits to that, though, because we're not using cysteine. You can open up the capsules and mix them into food if people are having a hard time swallowing the capsules.
Exactly.
The taste profile of the capsules is actually really pleasant. It'll actually mix into water or food really easily.
Yeah. So, several questions here. One that I get asked all the time, what's my opinion on the difference between FinBin and MeBin? I personally believe the only reason Jane McClellan's using MeBin, the only reason most universities like Johns Hopkins are using MeBin is because it's already FDA approved. And somebody needs to do an actual side-by-side double-blind study between the two. But this is my opinion as a non-scientist who's done a deep dive on the science. The 3 pathways that the PhD scientist in India determined why FinBin is working so well I believe MEBIN only has 2 of the 3, and the one that's missing is the P53. And that's why I believe FinBin is better, and that's why I recommended it. Now, if the only way you can get this is through MEBIN, it's a good replacement, and it's better than nothing. You know, there's a lot of questions here about FinBin and the liver. And when I started this 5 years ago, I recommended 3 days a week on, 4 days off because of all this BS about the liver. And then I found out that the research that determined FinBin could damage the liver was done at 1,000x the dosage we're recommending. Well, I can say to you, if you take 1,000 times anything, you're going to cause problems. And then later, Johns Hopkins actually did a toxicity study on the whole category of anthelmintics, and they determined that 500 milligrams a day long-term is safe.
Interesting.
And so I just don't think, I mean, some people do have their liver enzymes spike after taking it, and I recommend people do blood work at least twice a year to just check on that and maybe back off a little bit if it is spiking your liver enzymes, but I don't believe it's a chronic problem. So
And no people haven't reported any lasting liver damage from taking fenbendazole.
No,
Okay.
Let's see here. And also people with liver cancer, they get confused about, metastasis to the liver versus FinBin effect on the liver. I mean, they're two completely different, not even in the same question deal. So just because you have cancer cells on your liver doesn't mean that the FinBin is going to make that worse. I think the FinBin is going to help the mets to the liver, and it shouldn't be confused with, air. And by the way, everybody should, if they're worried about their liver enzymes, they should be taking milk thistle, daily with the FinBin.
Okay. We have some. Why don't we try to take one of the questions here on the.
Is it okay to continue to take the protocol with taking 3 different antibiotics? I don't think there's any reason why this would contradict antibiotics, and they're not even shouldn't be a problem.
Agree.
You agree, Dr.
I do
Linda?
agree, yes.
Okay, let's go back to this here then.
Would like to see the broccoli extract added to one of the pathways? Okay, there's a recommendation, Adam.
So, Dr. Wyndham, any preference which pathway it should go in? Maybe pathway 2 with the curcumin and quercetin?
That's what I was thinking is pathway 2. I just don't want people to not take it because sometimes they don't take that one because they're on chemotherapy. So I just wanted to reiterate that if you're taking chemotherapy like once a week, you can just not do the pathway 2 the day before, of, and after, correct?
Yes.
Correct.
But you could take it the other days of the week.
Right.
Yeah.
Right.
So we're thinking about we're planning a beta glucans product because we've seen a lot of benefit with beta glucans and the immune system and reactivating senescent immune cells. I'm thinking maybe broccoli seed extract and beta glucans and some other mushrooms as a pathway 4 product. So we're working behind the scenes on a number of things. So,
Here's a question: has there been any success with brainstem cancer? And
oh wow.
I'd like to remind everybody that the lady who is literally ground zero on this whole story was a scientist at Merck, and after accidentally curing her mice of cancer, she had 4-stage glioblastoma wrapped around her brainstem.
Wow.
And was told to go home and hire hospice, and she cured herself with FinBin.
And this is the doctor that called you.
No,
Oh, no,
it
she-
was a friend. He was a friend of hers. Yeah,
A friend of hers.
Right.
We have a phone call, so let's take the somebody calling in. Hey, you're on the Q&A session. What's your name? And, what's your cancer? And what's your question?
Fran Collins. It's regarding my husband. He has small cell lung cancer that metastasized to his brain.
Okay. What's your question?
My question is going to be, after 5 weeks of treatment, is he seeing anything with people that have had the cancer metastasized to the brain recover, or if they've had any kind of recovery from that? And we are still following the protocol, and we've included ivermectin with that as well.
Yeah. Well, the answer to your question is those of us with wide metastasis small cell lung cancer that survived is not a very large club. And in fact, I've been told that I'm the sole data outlier at MD Anderson in 45 years. So I say yes, stay on the protocol. Rule number one of medicine is don't make it worse. And this protocol is not going to make that worse, and there is hope that it could help.
Yeah. And we know that the Pathway 2 product does cross the blood-brain barrier, and Pathway 1 has a number of elements that can be really helpful. Dr. Wyndham, any comments that you'd like to add in?
No, thank you.
No, I think you guys covered it. I would just make sure that you're on the pathways and take it at the recommended dosage on the Joe Tippens protocol.
Yeah, and we would recommend do you have an integrative physician or a naturopath that you're also part of your medical team?
And that's to the caller.
That's to the caller. Yeah, ma'am. Do you have an integrative physician that you're also seeing? Okay. All right. I guess
Sorry, I didn't hear that.
Are you working with an integrative physician or naturopath?
No, I'm not. It's just something I found on my own. We did see an oncologist. We had chemo and radiation, which he did very well with as his lung cancer, but it was his, after that, a couple of months, it showed up in his brain. And then we did the 10 sessions of radiation.
Yeah,
and I've seen some improvement, but not a lot.
Yeah, so I was telling this earlier, I don't know if you heard me, but I was recommended at MD Anderson to take whole brain radiation as a preventative measure because small cell metastasizes to the brain about 95% of the time, and if you do the preventative whole brain radiation, it drops down below 4%. So I was lucky. I had the right advice at the right time and went ahead and took that.
Yeah.
There are downsides to it. I mean, I've lost a lot of short-term memory because of whole brain radiation.
Yeah.
But are they looking at any radiation on his brain at all?
We did. They did 10 sessions, and at the end of 10 sessions, it was they told us to call hospice. 3 weeks without treatment, 5 to 6 months maybe after treatment. As I said, we got home. He couldn't get up on his own, couldn't do very much on his own. I was feeding him. I was doing everything for him. It's been 5 weeks now, and he is mobile. There's a good bit of cognitive issues. There's times when he makes sensible statements, and there's times when they're nonsensible. So I'm just wondering if continuing with the protocol, we might can see some improvement there. We're scheduled to go back mid-February for a recheck. But in the meantime, we've had hospice come in and help with a lot of issues. But mainly I'm taking care of him myself, and I'm just hoping to see. I'm trying to be realistic, but at the same time, I'm saying, why not?
Yeah, why not? You should try.
There is one other thing you might think about adding here, and that's low-dose
But I appreciate
naltrexone.
what you're doing with everything, and thank you for taking my question. And
Ma'am,
we're hoping for the best.
Ma'am, Dr. Wyndham had a thought for you.
There is one other thing you may consider adding, and that's something called low-dose naltrexone. You can get more information at LD.
Hello?
Hi, can you hear me? Can everybody hear me?
I can hear you, yeah.
Yeah.
Okay. So
sorry.
it's low-dose naltrexone. It is something that really may
I think
help.
I'm having an issue with the...
Okay,
Yeah,
so
if
ma'am,
she'll
she
hang up,
can't
she'll
hear.
be able to hear,
Okay.
probably.
Okay, so ma'am, she's recommending you go to the low-dose naltrexone website. It's LD and naltrexone.
In-
Research Trust, ldnresearchtrust.org. ldnresearchtrust.org.
And we would strongly recommend get an integrative physician
Yes,
or
thank you.
naturopath that has a cross-training in oncology on your medical team. They will be able to give you so much more information than we can give.
So here's a really basic question that we need to start from the ground zero. The pathways are unfamiliar to me. What are you guys talking about, and where do I find it? Well, that's really simple. Go to the blog, mycancerstory.rocks, and click on the protocol tab at the top.
And that will link to our website or to other resources that
Right.
are available.
There's another one about FinBin Labs. I hate to answer. Is it 99% pure? The answer is no. It's been tested. It's not, and I don't think it's safe. So I recommend staying with Merck products. Here's an interesting one that Jane McClellan covers, I think. It's do tumors increase in size before dying off, making the CT results possibly inaccurate, or showing growth when it's really the protocol's actually working? Is it possible to have dead tumors show up on CT scan or scar tissue? I'm asking because I'm wondering if a PET scan is always best. She's confusing CT with contrast and PET, I think. But again, I prefer PET. I think a lot of people do. There is a possible false positive aspect of PETs if some inflammation can show up as a hot spot. But I'd rather have that than missing the small cell that's actually a bad guy.
Dr. Wyndham, I'm curious, have you ever noted in any of your patients that you are treating that as they go back, there is some type of spike as it relates to that?
Yeah, that's actually not uncommon. So sometimes it can happen that as cancer cells are dying off, there can be a spike in tumor cell markers. That's in blood work, not on studies. And on CT and PET scans, there can be an inflammatory process that does make it look like the cancer is larger
That
when
makes
it's
sense.
yeah, when it's being treated. And that's super confusing. And that's when you really, really need somebody on your side, an integrative or functional medicine specialist, to help you figure that one out.
Here's a pretty cool one from Kathy Cummins. It says, answering, Taylor, I'm on my 4th year of stage 4 Mets to bone and lung inoperable. Spots throughout, now CT shows only on the lung. I'm feeling good, working full-time and living life.
Praise the
Nice.
Lord.
Yay.
Do you know if the protocol works long-term for maintaining NED for survivors of lymphomas, surviving NKT cell lymphoma for 3 years, 8 months? I don't know the answer to that, but I can tell you that if it were me, I'd be on it 3 days a week as a preventative measure.
Should we be telling our listeners what NED means?
No evidence of disease is NED, okay?
Thank you.
Thanks, Doc.
Another pancreatic story. I've gone over that one many times. Do we know the success rates of the protocol without any conventional treatments? The answer is yes. In fact, the published paper that University of Washington and Stanford did on auditing some of my success stories, they chose people that were only doing the Joe Tippens protocol and not traditional treatments. And so that's pretty impressive.
So what was the percentages?
Well, again, with people all over the world taking this, I don't know the denominator.
Right.
You know, I know the numerator, but I don't know the denominator. So I think there's lots of success stories out there where they're only doing the protocol, but I don't know how to
We don't know-
quantify. I don't know
yeah.
how to quantify those.
Got it.
Lots of questions on blood-borne cancers, and yes, we do have evidence, including leukemia, on blood-borne cancers. Here's one that people get confused about a lot. Since fenbendazole is an antiparasitic, do you expel stuff? And the answer is I don't really care, because we know it's not the parasites that are causing the cancer. It is the 3 pathways of knocking out the microtubules, interrupting the cancer cell's ability to metabolize sugar, and increasing new healthy P53 is why it's working on cancer. I'm not sure there's a correlation to intestinal parasites.
It's just an added bonus.
Yeah. I tell people the good news is if you invite me over to your house, I won't drag my butt on your carpet.
Oh my gosh.
So Adam, I get two questions frequently, and I want to cover one of them really quickly, and then I
Sure.
want to hand one off to you. People are constantly getting a hold of me, Adam, and they're talking about, why can't I just buy curcumin off the shelf? Why can't I just buy quercetin? Why don't I just get berberine off the shelf? I need you to understand that are listening, we employ a unique patented technology that Adam and his colleagues at Oklahoma Medical Research Foundation through the University of Oklahoma Health Sciences Center employ with these unique compounds in nature that are called polyphenolic compounds. These do not want to absorb through the gut lumen. They're crystalline in nature. You can take high amounts of them and only measure a fractional or sometimes no signal in the blood with these ingredients. So the patented technology we employ in our 25,000 square foot facility here in Oklahoma City allows these ingredients to be migrated right in through the gut lumen and then hit the blood level at exponential levels. Correct, Adam?
Yeah, it's true. And there are other technologies that are available that do a decent job. There's one Danish technology that uses micelles and nanoparticles in there, but they're not specifically formulated with the quercetin and the curcumin and the boswellic acids. You would have to take a lot more of some of the other technologies like the BCM95 or the theracurmin. It's not that that those don't work. You just would have to take a lot more of them to get them to work. And there's some problems with some of the other formulations, like the theracurmin can cause stomach upset, etc. Ours does not. And we know that with the formulations that we're providing, that we're getting high levels of circulating serum concentrations of both curcumin and quercetin at a very reasonable price.
And berberine.
And berberine
Yes.
at a very reasonable price.
Yeah, and then Adam, the second one is people are frequently just calling Pathway 1 tincture CBD, and they literally liken it to any CBD they may find
No,
on the
it's not
shelf
even-
out
not
there.
even close.
And
Not
so
even close.
could you give us a quick snapshot of just that brief bit of research, snapshot that
it's
research
not-
we
it's
did.
not
No.
brief, though.
No, but I'm saying a snapshot. Bring it down into a brief response here for time's sake.
Sure.
And give them a little bit of that history.
So we've done a lot of work. In fact, we have some ongoing research. We've just done an update to the Pathway 1 where we've modified the frankincense. If you're getting a new bottle of Pathway 1, you probably will notice that it's a little more spicy than the last version of it. This is because we've modified the frankincense in the current version to make it slightly more effective. It's just a different version of it. We are working with the University of Oklahoma
Right.
and with Doris Benbrook's research lab, and we have ongoing research that we're allowing us to modify, update, and improve. But it's very important to understand. We spent 4 years looking at different cannabinoids, extracts, fractions, and trying to understand the relationship of cannabinoids to cancer. It's actually a big conundrum. Why do hemp extracts actually interact with cancer cells? Very few scientists have been able to answer that question. We believe it's an epigenetic effect. And so we've modified the extracts to actually make them highly adaptable to an epigenetic effect, which in layman's terms, we have more of the acidic forms of the cannabinoids rather than the decarboxylated forms of the cannabinoids, because we've seen those to be more effective in influencing epigenetic changes in cell lines, including cancer cells. And we've also modified the specific plant hybrid of hemp that we're using, which is highly effective, not just for the cannabinoids, but for the terpene profile that's associated with those plant leaves. Now, that's just the cannabinoid profile. There's actually not that much CBD. It's mostly CBDA in the hemp extract. There's also a standardized dose of CBGA. There's 7 grams of cannabinoids in Pathway 1, which people ask the other question, Joe, is why is it so expensive?
Yeah.
If we priced Pathway 1 according to just standard pricing practices, it should be a $500 or $600 product based upon there being 7.5 grams of cannabinoid in each bottle. But we've actually reduced the price because we do the extractions, and we actually we contract with the farmers to get the right breed of hemp. In the bottle is also frankincense extracts, and there's 7 grams of frankincense essential oils, which are terpenes, diterpenes, sesquiterpenes that are specific to frankincense, and it's packs quite a punch.
Okay, here's a follow-up question. It's lady's mother really can't take pathway 1 because it makes her nauseous and then vomit. Is there any recommendation of how she can take it better?
Oh boy, there are some people that are just going to be sensitive to it. My suggestion would be to take the minimum dose available. Where some of the monoterpenes in the frankincense can cause the stomach upset. We actually deplete the frankincense of as much monoterpenes as possible in order to make it the least irritable to the gut. We have some other options that are available. I just ask you to call our offices and discuss other options if that's the case.
And Adam, we do have a caller.
Okay,
waiting.
Rick, who do we got? Caller, you're on. What's your please?
Hello, Ron. Are you still there? Ron, are you still there?
Yes, sir. I'm here. I guess I can faintly hear you, and the live stream hasn't been live for a little while on my computer. But I wanted to ask a question regarding neuroendocrine cancer. That is a diagnosis that my mother has, and it's probably at a stage 3 or stage 4 at the moment. But it's a cancer that we've always been told by doctors and oncologists that's very unique. Oncology doesn't treat it the same way that they do other cancers because it goes through the endocrine system all over the body. It doesn't just focus in one specific area. I just want to get the panel's thoughts on treating that type of cancer with the protocol on the website.
I don't know. That's one I've never heard before. But once again, we're seeing good evidence that this is completely cancer subtype agnostic. And if you think about the 3 ways that it's working with the microtubules, with the metabolism of sucrose, and with P53, it makes sense that it would be cancer subtype agnostic.
Okay. Caller, you won't be.
That would make sense.
I'm going to ask Dr. Wyndham to chime in because she does she actually specializes in nerves and the endocrine system. You won't be able to hear her comments, but you'll be able to get her comments on the feed after the show. Dr. Wyndham, did you have any comments on that?
Yeah, neuroendocrine tumors can be treated. I would expect them, because of the way that they behave, to respond. I also don't have specific experience with fenbendazole and neuroendocrine tumors, but based on the way that they behave, I would expect them to respond to fenbendazole and the pathways 1, 2, and 3, the oncoadjunct. And so these specific tumors don't respond to IV vitamin C, but they should respond to that.
Oh, interesting. Okay. Thank
Adam,
you.
there's a question before and one here, one about Europe and one about Australia. They can get products in Europe through your European distributor.
Right.
What about Australia?
So through Australia, also either through us or a European distributor. But we need, if you're in Australia, you need to get in touch with us by email because we have to set up your shipment differently than is available through just our website store. So we recommend sending an email to either to Adam at ultrabotanica.com or just go to our webpage and go to our ask information or contact us form. Send in your address if you're in Australia, which products you want, and we'll put together an electronic invoice and get you a quote how much it will cost to get that shipped into Australia.
Adam, and I'd like to add, if any of these Australian people that are dealing with active cancers are currently going to an integrative physician or a physician that they love in Australia, in New Zealand, as you know, Adam, we've got a doctor there that is writing prescriptions for his patients so that the product can actually be sent into the particular area. So if you have any integrative naturopathic physicians in Australia, please get them in contact with us. We would like to be able to know of them.
So
and build
what
that
you're saying is that
relationship.
they can write a prescription for Pathway 1.
Yeah, there's areas, as you know, Adam, we have difficulty shipping it in where customs wants to stop it. And so this is the way we've solved that riddle in New Zealand, is through a doctor there that is actually writing prescriptions and then sending those in, and we send those prescriptions out with the order, and customs is clearing them.
That's good. Yeah, that's good.
So I get a lot of questions about Keytruda and what it impacted on me.
Yeah,
and
there's one on the website here,
and there's
too.
several on the website here. And let me go into a little bit of detail there. Keytruda is a really, really good immunotherapy for non-small cell lung cancer, for example, and other cancers. It just hasn't proven to be true with small cell lung cancer. And in fact, the clinical trial of Keytruda that I was on, I was the sole data outlier in it. And it's not a secret to my doctors that probably the reason I'm the sole data outlier on that clinical trial is because of fenbendazole, not because of Keytruda. I think it works. I think the protocol works wonderfully with Keytruda and other immunotherapies, probably other than small cell lung cancer.
Interesting. I'm just curious. Why are people saying that it's contraindicated with CBD or the Pathway 1 or Pathway 2?
There's a lot of, if you want to take a position on anything, you can find something out on the internet to prove it.
Yeah.
It's just ridiculous, some of the stories that get out there in terms of contraindication of,
Yeah, this or that.
Here's somebody that says you can't take CBD or Pathway 2 when you're on Keytruda.
So this is where we really strongly recommend get a functional doctor on your medical team, or a naturopath that has a cross training in oncology. They will be your best ally in making the decisions on which natural supplements you can take with the pharmaceutical drugs that your oncologist is prescribing, and be able to give you solid advice that that we're able to give as much advice as we can give, but you're having an integrative physician on your team is going to be your best ally.
Yeah. Lots of other success stories have been posted in here just since we've been here.
Any of them you want to read here?
Well, I'm in remission from stage 4 lung cancer, and ever since I did Joe's protocol and oncoadjunct, I feel amazing. I'm spreading the news. That's pretty cool.
That's awesome.
So, getting towards the end here.
We got a lot more coming in.
Hey, here's one for Dr. Wyndham. Are you located in Oklahoma?
I am.
Yes,
I'm
she is.
in Oklahoma and California. Is it okay for me to give my website?
Yes,
Sure.
absolutely.
Yeah, please.
Be excellent.
Okay. You can find me at wholehumanlife.com. Whole is WHOLE, humanlife.com.
And we'll find a way to post that as well, Adam, on the website or something, so that people can know how to reach out to Dr. Wyndham.
Right. Mm-hmm. Here's somebody else asking where they can purchase the protocol. Again, go to the blog, mycancerstory.rocks, click on the protocol tab at the top, and all the information is there for you.
There's a question from Jewel Wallace Howard. She's saying her husband has been diagnosed in September with urethral carcinoma metastasized to the lung and kidneys. The doctor says he's incurable. He's been on the Panicur C once a day and on since the end of November, and increased it to twice a day. He's doing picking protocol Pathway 1, hard time with it. He's on blood thinner Xarelto, but is afraid to give Pathway 2. However, his oncologist is at the point, since things have regressed without the cisplatin, he's put him on carboplatin, and the tumors grew, and is considering taking him off Xarelto, but is yet to do so. He has no AFib issues and putting him on Pathway 2 immediately. The thoughts. Jewel, our strong recommendation is please get yourself an integrative physician to help you navigate these questions. We don't think that there's any problems or contraindications here with Xarelto, but that's something that your doctor you need to discuss with a good integrative physician. And there are plenty of integrative physicians in Colorado that could be on your team.
Here's one. Will the protocol affect scans? Should I stop prior to a CT? I don't think so.
No.
There's no way the protocol's going to affect the scan.
And in fact, the curcumin in the if you're doing a contrast will help with detoxify any of the contrast toxicities that could happen.
Hey guys, I do have one question here. This the last person said that they were taking one pill a day of the Panicure. That's 222 milligrams. Isn't the up-leveled protocol 1 gram a day? Wouldn't that be 4 pills
No,
a day?
so there's in Panicure C and Safeguard, there is 222 milligrams in 1 gram of powder.
Right.
Yeah.
Oh, got it.
Okay,
A
so
lot of inert ingredients.
and one of the questions here was about people doing increased dosages, and it's really funny. Remember, I started 3 days a week because I was worried about this BS about the liver. Increased that to 7 days a week with 222 milligrams of Finben a day. And now we have people all over the world trying 2, 3, 4, and 5x that dosage, and doing okay with it. So if somebody wants to experiment with it, as long as they're getting regular blood work and checking their liver enzymes, I say go for it.
Joe, you had mentioned, I want to remind you, you had mentioned something about people procuring Panicure C and other things. They mentioned bulk amounts or where they can get it inexpensively. Do you have any insight to them? Because we hear that a lot.
Well, you can buy Merck products, Panicure and Safeguard, and by the way, they're the exact same product with just 2 different brands.
Right.
You can buy that in bulk.
Okay.
You can buy it in tubs. And I just don't recommend these other kind of fly-by-night companies following my success. And I'm not jealous of them making money off of it. I just don't recommend their products.
And yeah, why use something that's not pharmaceutical grade when you have a pharmaceutical grade product available made by
Right.
Merck,
Yeah.
so you know the potency.
Here's one. GBM4. What protocol would you do if you have 5 years of clear scans? That's cool. I would stay on it 3 days a week, indefinitely as a preventative, because GBM can reoccur just like small cell can reoccur.
So I think we've. Are there any other questions on the feed there, Joe? That we have some
No,
new
I
comments
think-
at the bottom.
Here's is the pathway protocol recommended for dogs with cancer?
Absolutely.
Guess what? Over on the Facebook group, we have a separate pet section, and there's a ton of members of the pet section, and a lot of success stories with dogs with cancer over there. I think that's about it.
All right. Any Josh? Any closing thoughts here?
No, just want people to know that you can share. When we, this will be immediately available. What you heard today will be immediately available on Joe's Facebook page. Some of you are not members of that Facebook page. We are going to be posting this
Also
same
on the
link
blog.
On the blog.
also on the blog. Please share it with friends or loved ones that you are concerned about. Oftentimes, that third-party credibility coming from other people rather than a relative is what will help someone be enlightened to trying something new or different.
And
May I
Dr.
make a-
Wyndham, yep, please go ahead here. Let me.
Thank
focus.
you. I really want people to know that cancer is both treatable and curable. Sometimes it can't be cured and people need to live with cancer, but cancer in some cases can be lived with in the same way that diabetes can. And it is much more treatable than we probably believe, within most people believe, and there are many integrative specialists that specialize in treating cancer. And so the biggest thing that I see, the biggest hurdle to overcome is for people to understand that there are treatments out there, that fenbendazole is one of them, oncoadjunct with fenbendazole even better, and there are other things that can be done also. So please do your homework. Make sure that you're doing everything that you can.
Great
Yeah.
words.
Great.
Great
And I
words.
think we have one caller that wants to slide in here. Go, caller. You're on.
Yes, this is Patrick. Question: I'm taking the pathway 1, 2, and 3 along with 222 milligrams of fenbendazole twice a day. I take the pathways 2 and 3 with the fenbendazole, also with some organic coconut oil.
Mm.
My question is about the Pathway 1. I'm taking that just at night. Is that the recommendation protocol?
There's a little card that we put in with the product, with Pathway 1, that gives some suggested dosing. And the dosing for Pathway 1 is our general recommendations. We do strongly recommend working with an integrative physician or naturopath to dial in what would be best dosing for you. We recommend, in general, starting Pathway 1 at night to see how you tolerate it. And if you can tolerate it well, then start to add a morning dose as well. How are you tolerating it? Is it okay?
Just fine, no problems that I've noted.
There is a weight to dosage recommendation. How much do you weigh?
180 pounds.
So 1.5 to 2 mLs twice a day would be a recommended dose for you. If you can tolerate it, that would be optimal.
Okay. Now, if I was taking it at the same time as I was taking Pathway 2 and 3 of fenbendazole, would that be the recommendation?
Absolutely.
Okay.
If you're following
Right.
Joe's protocol, that's his recommendation. And again, we would recommend you getting with an integrative physician to dial in specific.
Dr. Wyndham, somebody's asking if you know of any integrative physicians in San Diego, and
So I practice in both California and
that was my question.
Oklahoma.
Thank you
All
very
right,
much.
thank you for calling.
you.
Yeah, go ahead, Dr. Wyndham.
I practice in both California and Oklahoma. I spent 20 years in California and started at Whitaker Wellness, where we treated a lot of cancer. Depending on what type of cancer it is, my referrals in the area are a lot different. So there are several people in Southern California. You can look up Cancer Control Society or People Against Cancer, peopleagainstcancer.com, and they have a referral system.
Or they can call you to get some information. What was your phone
Yes.
number again, Dr. Wyndham?
It's 888-888-338-3408.
so Dr. Wyndham, there's a whole rash have just come in about 5 different states now. So is there one website somebody can go to find an integrated physician in their state? Or is that...
There are 2 websites, ACAM, ACAM.org, and A4M, the letter A, number 4, letter M.org.
Okay.
Those are for general integrative practitioners, though. For specific integrative practitioners that specialize in cancer, I would go to Cancer Control Society or People Against Cancer, because they will refer you to a specific doctor who specifically treats cancer.
Perfect.
That's
Thank you
awesome.
very much.
My pleasure.
All right, well, I think we're going to wrap up the Q&A session. This has been January 18th, 2023. Thank you for joining us. We appreciate all of the questions that were sent in. Unfortunately, we weren't able to get to a lot of them, but we certainly covered, I think, a vast majority of the topics here. Any last thoughts, Joe?
No, thank you.
Well, thanks, everybody.
Be
Thanks for joining.
encouraged.
Bye-bye.
Bye.
Take care.